Hi everyone, it's Matthew McKenzie here. I raise awareness of unpaid carers, especially those who care for someone living with long-term mental ill health. This is due to lived experience of being a carer for a close relative living with mental illness. Also raise awareness of those caring for someone with cancer. And this is probably down to the groups that I run aimed at unpaid carers. However, today I'm going to be looking at something quite controversial and something that will affect most, if not all, unpaid mental health carers. And as you can see, this is actually, by the title, the challenges of being too involved as a mental health carer. And I'm sure those watching, or especially if you're a carer, know exactly what I mean if you're caring for someone using mental health services. And be warned, there will be some some, if not a fair bit, of controversial topics here because of my own experiences, what I've heard from my carer groups. The carer isn't often always at fault, and it might be due to resources and a few other things which I'll point out. So it's just going to be very, very controversial. But also, I will provide some solutions, even if it's just minor. I will have to speed up on some parts of this lecture because it is quite long because there's so much involved in it. And to be honest, there are some parts missing that I felt might be added to another lecture in the future. Before we do begin, though, I'd like to mention if you like the content of this YouTube channel, because I do sometimes raise awareness of special days, special months regarding awareness of mental health of carers. Do give this video a like or add something in the comment or subscribe to my YouTube channel. So basically, what does being too involved mean? Well, if you're caring for someone with mental ill health and they're using the services, but there can be situations where, out of anxiety or worry or concern or out of care, things get out of hand. And as you can see here, I've put down constantly monitoring or managing the person's every decision or behavior. Now, this does happen, especially if you're new to the caring role. And I'm not saying every unpaid care does this, but this can and does happen, and this is not a good thing. But there's a reason why someone would do that. There's many reasons, but we'll look into that anyway. I've given you quite a few. Obviously, you're just anxious. Okay, you're worried due to the symptoms or the diagnosis of the what your loved one's going through, mental health. You are concerned a crisis is due to happen when it might not. The other thing is the other side of the scale. It's not just monitoring someone's every single step. Checking in on them constantly. It's when you actually now start to neglect your own needs and identity in regards to your caregiving role. No doubt you're going to be providing caregiving, and as I mentioned, there'll be situations where this can't be helped, and I will go into this later on. But this isn't a good thing when you are neglecting your own needs as a carer. So this may start to flag up that you're being too involved in your caring role. The other thing, and I don't think this is too serious, this one actually, when you're being relied upon as the sole or primary support with little to no backup services. Why do I think this is not a big problem? I mean, it is, but to be honest, let's be realistic. This is the situation of many unpaid carers. Obviously, you're going to be relied upon anyway. That's why I've mentioned this one third. It's not the top one. It is a problem, but I think it's part of the territory. But it also shows that you're too involved as well, because there should be other resources. There should be other backup from services. You shouldn't have to be the sole means of primary support, and that can be an issue, can be a problem. And again, I've mentioned this fourth. I don't think it's a big problem, because there are situations you just can't really, you're unable to step away because there's no resources. So feeling unable to step away, even when it's necessary, I suppose when it's necessary, I think, is important. You shouldn't be there 24/7. You shouldn't have to be. I did say this is controversial. There are those out there that feel they've got no choice, and at times quite rightly so. But then at other times, when it's necessary to step away, and you can, then that is an issue. That is a problem. So these are some of the things, not all of them, but some of the things when others will flag up. You're being too involved. But do take note. This is controversial, and I will get into that in a moment. And I think it's a really important topic because I do feel a majority, maybe 90% of carers will experience this. So, what are the outcomes? What's the impact of being too involved? And there are a lot. Um, but I feel it's important to mention this because things will happen basically, and if you're not aware of being too involved, you will put yourself at risk. So I'm going to put down reasons, why what tends to happen if you're too involved, and it's not just emotional, psychological. It's also the social impact and other impact into the carer's life as well. So the very first one, obviously, is burnout fatigue. If you're doing something constantly in regards to your care role, when you care for someone with mental ill health, and I've given some examples: eating disorder, someone going through psychosis, self-harm. Um, there's lots more to it. But being they're constantly trying to care and support will eventually lead to emotional strain, without any breaks. You will burn out. Um, and you will suffer from fatigue. You won't be too tired. You won't be able to sleep well. That means you can't function well. And this puts you um, at mental health risk as well. We also got the guilt and anxiety. And I think, to be honest, you're going to experience that anyway. But when you're constantly trying to provide care, it will lead to guilt and anxiety, hence fear of something going wrong and not being around. Obviously, if you're living with a person, it's going to be different, because you are going to be around. But then if they're going through severe mental ill health and a crisis, then you will experience that guilt and anxiety. If you're not living with them, then yeah, that's going to be a problem. Because you'll be constantly checking in, worrying, and that I agree will have that impact on being too involved, when you care for someone with mental ill health. You also got losing your identity outside of being a carer, and I will lead on to this in a bit. This is actually real confusing. I don't think that's the correct name for it, actually, but it's when you're losing your situation, like you're caring for your young child or your partner, but you lose that identity. You lose that role. Your sibling, you lose that role because you're now being the carer. You're almost making the decisions. You're watching someone constantly, in regards to double checking their actions. This is the big one, I feel. Depression and isolation. Isolation also being a big one. Lack of support or understanding from peers or professionals will lead to that isolation and hopelessness. You feel you're not in control of the situation, and that creates a psychological toll. And I've mentioned this already. The other side of the coin, where you're neglecting your own health, and you're actually skipping appointments for your own health. I didn't mention poor sleep, and I should have added this one as its own subject, the stress. But I've just quickly put that here regarding neglected health of unpaid carers. But it's not just those things it affects when you're being too involved. There are other things. Let's say the situation, if you're a working carer, this will impact on your working role. And if you're not working longer hours, then your income will suffer. So there'll be reduced hours or even having to leave employment altogether. Absolute a disaster in some situations. Then you have situations where you're now socially withdrawing. No access or lack of time for friends, close friends, hobbies, or relationships. And this leads back to one of the solutions, actually, being those care centers, why they try so hard to get carers to access hobbies, um, meet other carers who may understand that situation. So, yes, you're being too involved as a carer, um, and you're constantly at some point now at loggerheads with the person that you care for, and this will lead to relationship strain with the person you care for. How would this come about? Well, it's our dependence. The cared for person may become so reliant on you. This will limit their autonomy. They will obviously try and seek autonomy outside that, um, because you're almost making every decision. You're almost double checking. They become too reliant, and that means their independence will suffer, and that means that you have to do a whole lot more. Then the control versus support, I did mention control a lot. This will create tension between wanting to help and being perceived as controlling, not just only by the cared for, the person you're caring for, but by health professionals who want to flag up the warning signs, and even also by carer support officers who may also flag up warning signs, and there are situations where carers overstep the mark. This is also a big one, the loss of boundaries. You're not saying no, and this creates the emotional immersement can lead to conflict, to codependency. This is where I added that a picture here. No one, after a very long time, can stand these things, and they will create strain in that relationship where those who are going for mental health will not want the carer involved, and those things are for good reasons. But then they're not the only reasons. We'll come into that in a moment. So it's not just a conflict now with the cared for, because they're becoming so dependent on you, and they might not like that. They most likely won't like that. Not 100% all the time. I do admit there are others that have come to terms with their mental health and are aware they need support. But I do feel the situation is that we will have those that don't really want to be, I suppose, I don't know if this is the best word, smothered, really, being checked on, being almost told what to do. It's really difficult. And it's not always the carer's fault. Sometimes there needs to be a focus on giving the carer training, support, and setting boundaries. We'll come on to the solutions in a bit, actually. But the other side of the coin is the conflict with the mental health services. There will be conflict with professionals who will try and flag up um, if the carer is being too involved. But this is where it starts getting controversial. Well, let's look at the situations on why they would flag this up. So the impact on this actually is when they do flag this up, this will lead to the carer actually being sidelined or excluded despite being deeply involved or being the only person trying to provide that care and support. And mental professionals will look at past history, or will hear from the service user or mental health patient about the relationship, and will give their views to the carer and will flag these things up. And this will be the impact to the carer. They'll start feeling sidelined or excluded regarding mental health services. This is now where it's getting really important. Now starts to be frustration with confidentiality laws that block carer. I should have put carer involvement, but it's also information sharing as well. Don't get me wrong, information can be shared actually, but it's what the type of information. But then when it comes to information sharing regarding how the carer can be involved, and that starts getting blocked, and the carer will start to query how on earth can they provide care because they're not sure what they're dealing with. But then when someone is too involved in providing care, this can start to happen. Confidentiality laws will start kick into place. Overstepping professional boundaries or unintentionally causing friction with the professional health professionals, or mental health professionals. Um, Carers will start querying and questioning professionals' decisions and why they flagged up that you're too involved. And this will cause, as mentioned, friction. And then this don't happen straight away. I think this takes time to happen, but it will often lead to situations where carers, families and carers will have resentment from those services. You may perceive that the carer is just being interfering or demanding, and there may be correct reasons as to why. Not everyone is the same, but I did say this is getting controversial, and I'll go into this in a moment. There may be very bad reasons why this has happened. These are just some of the things which will lead the carer to be in conflict with mental health services, not just the cared for, when they're becoming too involved. But why do these things happen? And this is why I titled this. I think it's linked. It's heavily linked. Systematic failures that lead to over involvement. These things, they might not always need to happen, but when they do, then what's the cause of it? Why does someone decide to become over involved or too involved? Well, it's obvious. The carer is struggling. They can't get the resources. They can't get the respite. They can't get the education. They can't get the training. They can't make their voice known because there's lack of community support. It's been dwindling away. There's been a lot of cuts on services. So obviously, there's not much of a choice. You've got I've gone the wrong way around. You've got the situations where it's delayed or insufficient mental health care. So this means that they might not say it outright. It might be the worst known secret between mental professionals or mental services, but they are fully aware that the carer is going to have to fill that gap. There is no way out of it. There's lack of staff, there's lack of services, um, there's lack of awareness from the patient, so they're not really aware of the mental health needs. So the first might not say it outright, and sometimes most is a fair number that will actually say no. We need to make sure the care and family care are in the care plan. They're aware. We'll support them. But there's situations where services are delayed and or is just insufficient, and thus the carer steps in. They become over involved in their role. This one is probably the most common of all, I reckon. Poor communication from NHS or services, which means the carers, again, they're stepping in because they have to. No one's telling them what to do, so they have to fill in that role, they have to manage everything. And as we know, the NHS is in financial issues, financial difficulties, let alone the social services, everything's getting cut. So it makes sense. Families and carers are going to have to take that weight. They're going to start managing everything. They've got no choice. And I've hinted this, I've actually outrightly said that, to be honest. Underfunded care support programs, they don't really recognize the intensity of the mental health caregiving. I don't show I'm laughing. It's not really that funny. It's just the irony of it. These care support programs are meant to recognize how intense and challenging mental health caregiving is. Unfortunately, due to the funding issue, we can't get those who are fit, really educated and versed to raise those things and support families and carers again, which will lead to families and carers not having much of a choice but having to become more involved. But is this always the case? This is now, I'm going to start straining into controversial issues now. When they flag this up, is it to a carer, mental health carer? Are they really saying you're too involved, or is it because you're persistent? And there will be a lot, a lot of the things where the carer's just been persistent. They're not really being too involved. So what do I mean by this? Why does this create a controversial problem here? When some carers, some cases of carers are actually labelled, not outright, or not always outright, but they're labelled obstructive or overbearing. But to who? This is and I felt it's important to mention this because it's not always the carer's fault, especially when they're raising concerns or when they're asking questions, um, and very clever questions as well, or to advocate persistently for better care. Now, none of these things are wrong. They're not wrong. This is what a carer should be doing. But there are scenarios, especially if there are lack of services and the professionals are under pressure, that controversially they will start to label, not outright, I won't say it anywhere, but they will say you're becoming too involved, as you can see by the pictures here. This is what I feel anyway should really happen. Well, shouldn't actually. What I mean, obviously, professionals should work with carers to set the boundaries and improve collaboration, but unfortunately, some mental professionals may shut down contact completely. This does happen, and this creates a big problem if it becomes culture, which can happen because of lack of communication, lack of information, lack of defined roles, lack of services, lack of care awareness and training. And if it's the culture of the mental health services, there will be situations where carers are just actually pushed out. I'm not saying that this shouldn't be a case where, obviously, if not all carers are the same, there will be situations where carers are overstepping the mark and are becoming too involved. I agree. But there are we can't ignore the situations where, because a carer is raising a concern because of an incident or an issue, or they're asking questions, or they're being a really good advocate, they're really putting that pressure on, that services will start to shut down contact with the family or carer. Going on from this, how does this come about when services act this way? They will start, and I did say it's going to be controversial. I've said this anyway midway through this lecture. They'll start invoking confidentiality, and it'll be used to justify not sharing any information, even when the carer actually plays that central role anyway. This is a big problem, especially if it's the patient versus the family carer, and there's a lack of I've forgotten the word for it. I'll just say awareness for now regarding the patient. I'm sure mental professionals will sort of weigh up the situation, the scenario, and still want the family and care involved. Each case is different. Each mental health case is different. It's not a one shoe fits all, and it should never be that way. But there will be situations, unfortunately, when mental health services will say, "Oh, you're too involved. We're now going to invoke confidence." It might even not even come from the mental health services. It might come from the patients, and sometimes, by rightly through law, that I can understand that. But there are other times where that can become a problem, and this can even confidentially can come into play, even if the patient didn't mention much about it. But it's not just confidentiality, though. Restricting access. So the mental services, not just mental services, could be social services, might actually start to bar carers from ward visits, bar carers from meetings, bar carers from updates on information. And again, what flagged this up is by mentioning that the carer is too involved. As in saying, not all carers are the same. They're going to be different ones. There may be good reasons, absolutely good reasons to act this way. But do not get me wrong. There are the reasons they should not be doing this. I just want carers to be aware of this. I've heard this a few times in my groups, and I've been through this myself. Um, Obviously not at this sort of frequency, but there are situations where, because of lack of awareness, care awareness services, there are situations. It's very sad that access is restricted. Mental health law does come into play in this, and obviously there's good reasons as well. But then let's be realistic. There are reasons why mental health law is just a blanket um, sort of rule that is not used correctly. And life doesn't play out that way. It's not a black and white issue, and it should never be that way. Then we got the professional gatekeeping. So carers may be told, look, you're just being too emotional, which is a very clever way of pushing carers out. Or you're hindering recovery regarding the patient, or you're being too interfering. You're being, you know, another thing I forgot to mention is you're not the professional. So you don't tell us what to do, and therefore we don't want you involved. You're being too involved. So that's under professional gatekeeping. The other one, which is ever so sneaky, is jargon, the use of language. So the jargon can be a very clever way of coming to decisions to not involve the carer, family carer as much, or to confuse them and push them out of that role, minimalize their involvement. There are other things. This is a whole different lecture, by the way, but there are other things that can be the outcome of being too involved. I did say it was fairly controversial, but these things do happen. They will actually start to weaponize carer fatigue. So services actually may imply that the carer is no longer helpful or safe to be involved due to emotional strain. So this is more of a catch-22 issue. The carer had no choice, so they had to become too involved. This in turn leads to the fatigue, care burnout issue, stress, anxiety. This in turn is noticed by the professionals, who in turn say, well, because you're going through caregiving strain and burnout fatigue, you're not prepared for the role. But then that's just saying, you're not prepared for the role because you're not prepared for the role. It's a never-ending cycle. And they're using it to weaponize that, to say you're not fit for the role. But then the situation is, if you're not given the resources, then how on earth can you be? I've put this bit here, the last bit, saying without offering alternatives or support. So it's basically they've come to a decision saying you're too involved. Um, you're asking questions they don't want to hear. They might not say it outright, but they won't provide any alternatives or support, which leaves you in a sort of a dead end situation. And that might also leave the patient in a difficult situation as well, to be honest. But these things can happen because of being too involved. There are situations where, yes, it is important, and they will flag this up and say, look, this is a warning, you're being too involved. But they won't stop at just that. They would say, listen, you need a care assessment. What support can we give you in place? Now, that's fine. But when it's like weaponizing it and just leaving it at that, then that becomes a problem. So, okay, I've gone on a bit regarding this lecture, but I thought I had to do this one because it does affect almost every mental health care, and I think it's so important to look at what can help. So obviously, I've said this before, respite care is lacking now. It's so important having that time away to rest, reset, reflect, and feel like you're more than just a carer is so important. This is not always available for everyone, unfortunately, but it's one of the things that can help. And I've hinted at this. I did mention about those care centres. Where they're going to come from, they're going to come from the care center regarding these care support groups, not just the care centers. There are other ways of getting access to them. Even the mental health services usually do provide them, and if it's not that, it starts to actually become organic, where carers may meet up, maybe on the ward, and start forming their own. In fact, I advise that they do that. Not easy, obviously, but this what you want is to form a network and connection, and the big reason for that is from strengthening that identity, navigating the mental health system, learning more information, and feeling you're not alone. You reduce the isolation. I've done a presentation on this previously, so do search my YouTube channel regarding the forms of different care support groups. This one's more tricky, to be honest. Learning to set boundaries and balancing your caregiving role, and learning when to step back, learning to say no when you don't want to become too involved. That, again, is a difficult one. There's situations where it just can't really be helped. But these things are really important. There's a lot more to it. I will do a presentation on this at some point on what I mean, what could help regarding boundaries and balancing your caregiving role. And yeah, I've hinted at this one, professional education, really. The sooner you understand your mental health caregiving role, the sooner you can get access to professional education. And this is actually understanding the diagnosis, the illness, but also the role, limitations of actually being a mental health carer. And there are a lot of them. The duty of this actually usually comes from the mental health services. If they don't give you, and this is where the confidentiality problem kicks in, if they don't give you some education regarding your role, then there's going to be big problems in the future, to be honest. Uh, Last but not least, um, you do need skilled, engaged professionals. And when I'm saying that, I'm talking about care aware mental health professionals, psychiatrists, and care coordinators who actually do include cares constructively, not over rely on them, not sneakily say, well, you just get on with it. That's the most common word out there. You get on with it and good luck. We don't want that sort of type of behavior. I'm not saying it's easy for them to do. It requires a lot of training, a lot of awareness. But this can help if you have engaged professionals. This can really help avoid the situation of being too involved. I don't think, though, that being too involved is unavoidable. I do think every so often it may happen. It's just that I think it's part of that learning role. It'll only become a problem if this is a long-term issue. So my final reflection on these things, and do take note, this sort of presentation, this lecture isn't finished. I just split things up a bit about good reasons on why you shouldn't be too involved. But then there are reasons where you're not really too involved at all. You're just doing your role, but something's gone wrong. The culture of the services are using it as an excuse, or there's a situation where the patient is not fully aware of what they're going through, not aware of the support structures, and leads to powerlessness of your role. So involvement actually is a strength, but without support, yes, obviously it can become a burden. So the idea is bringing others together. It is a strength, but as I said before, if there's cuts, lack of resources, policies that come in when there isn't the resources to support those policies, and I am talking about mental health law, then yeah, it's going to affect the quality of the services. Everyone has a role to play. The mental health system must share responsibility with carers and not just transfer it. I might not have said this outright throughout the presentation, but it may be hinted that we all must be involved. We can't be just sort of told we get on with it and good luck, or we don't want you involved and that's it. It must be shared, and I'm not saying it's easy, but shared for education, awareness, support. We also got the situations carers need the right to step back without feeling guilty, knowing support is actually in place. If it is in place, obviously do step back and focus on your own needs as a carer. I'm not saying it's going to be 100%, but there's situations where you should be stepping back and not becoming too involved. However, being too involved can sometimes be a reflection of how unsupported a carer has been, not how inappropriate they are. If the system pushes, a carer away instead of working with them, then everyone actually loses, especially the person in crisis. Then that's the other side of the coin. Sometimes you're just not really too involved. It's just how the system is. And I'm being realistic, absolutely being realistic. If support is not there, then what choice? What choice as a family, close friend, unpaid mental health carer has? But anyway, I do hope this is sort of given a bit of an awareness, or at least um, something to discuss. It's not, it's a deep, difficult, dark topic, and it's a sad situation, really. But it's important that people are aware of it and can focus on their own role, whether they're patient, professional, or carer. And I'd say thanks for dropping by to watch my video. As I said, if you find it interesting, do give it a like so others can have a look and make their own thoughts. I'm not going to please everyone. I'm sure it's going to annoy others who feel how dare do obviously you're defending families and carers to being too involved. I'm not saying that at all. I'm just saying these things happen, and there are situations where the patient is absolutely right. I do want patients to have the autonomy and independence to recover. But the diagnosis is lack of resources. We cannot deny that. That are very difficult. Anyway, as I said, if you're in that role, what I do want is, look after yourself. Whether the patient, carer, or professional. See you again soon.